Alright guys, welcome back to this Facebook channel. My name is Noskeleb Abiodun D, and I'll be taking us on some pharmacological tips and tricks today. So if you are here on this channel, you are not here by mistake as a nursing student. Grab your writing material and enjoy the ride. So the first thing we'll be talking about today is why you as a nursing student are fond of writing nausea and vomiting together as a side effect of every drug. Yes, you know you are guilty, and I know that you are actually thinking of how you are guilty because for every drug, for the ones that you know, the ones that you have not heard about, the ones that you've served probably on your clinical posting, and those ones that the names sound funny to your hearing, everything is nausea and vomiting, nausea and vomiting, nausea and vomiting. Actually, it is not a bad thing to write nausea and vomiting together, but in this our session of tips and tricks, we'll be making us understand how we can earn more mark with few points and how you can not model points together and common mistakes that students make. We'll be breaking them down. So nausea and vomiting are two different things entirely. One is nausea and the second one is vomiting. I do tell my students in class, whenever I take them, whenever you have to write side effect of drugs, even if you do not know it, you know, most drugs that are not parenteral that you administer via the oral route. One of the disadvantages of oral route is that what it irritates the gastrointestinal lining and it can cause vomiting, it can cause nausea and everything. So I do tell them for every drug, for every oral drug, please, for every oral drug, put nausea as number one, then number two, vomiting. Even drugs that are coated with sweet lining, like the ascorbic acid, the red ascorbic acid, and the likes, the quadine and the likes, they still makes you feel nauseous because body chemistry differs. Body chemistry differs. So what am I saying in essence? The first strip is do not write nausea and vomiting together as an effect. If you want to write them as an effect, number one should be nausea, number two should be vomiting. It should not come in any order. There is no law that says that nausea and vomiting should come in ascending or descending order. You can feel nauseous and might not vomit, and you can vomit without actually feeling nauseous. So what's nausea in essence? Nausea is the feeling of sickness. It is an inclination to what? To want to vomit. And vomiting on the other hand is what? It is like a trajectory, emission or ejection of your stomach content via the mouth. So it is not all drugs that will make you feel nauseous. And it is not all drugs that will make you vomit. And it is not all nauseated feeling that will lead to vomiting, and it is not all vomiters that you can actually vomit without feeling nauseous. So that's what I'm saying in excess. Breaking it, learning to break it to two can 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 actually earn you more marks. Let's say one more mark other than writing nausea and vomiting together. So that's that. That's the first tip. The second tip I'll be talking about is many students have tested me on our channel, on our DM, and we received so many messages about, oh, please talk about some side effect of drugs. Talk about how we can easily know the side effect of drugs. Are there tips to know the side effect? Well, there are tips to know side effects of drugs if you actually find yourself in a dilemma. Most times you read before entering the hall for exams, not only nursing council exam necessarily this time around, for school exams most times, and because you read with fear, you read with anxiety, you are nervous, um, you are disturbed and perturbed. Most times you forget most things in the examination, or we call it examination rush, and most times some people experience what we call a brain block in the exam, or you have the feeling of, oh, I want to remember this thing, but you can't really remember it. So in case you find yourself in any such dilemma, there are easy tips to remember drug side effects. And what are the easy tips? Before I go into those tips, I'm actually going to let you know that you as a nursing student, or you as a nurse, you are saddled with the responsibility of what? critical thinking. That's why we study psychology, psychiatry as a course in school. You as a nurse have to think critically. In your place of work, if there are nothing to work with, you should be able to improvise as a nurse. That's the edge you have over every other profession. So why am I talking about critical thinking? I'm talking about critical thinking because you would actually be needing critical thinking in the tips that I want to go into. Okay, so how would you know a side effect of a drug? Let's say, take for example, Caleb Abiodun is a 400 level nursing student sitting for the November council exam, and there is a question that says, Mr. Famorio, a 54-year-old farmer, was diagnosed with acute renal failure. He was referred to your clinic, and you are to administer a diuretic. Let's take furosemide Lexis for example. Under the following heading, write on the following heading, side effect. Okay, let's say side effect number 1 now. And you are like, oh, I've heard about this drug before, but I do not know the side effect. But I know what this drug, I know what it does. Fine. So if you know what a drug does, you know the side effect. Now you just need to employ critical thinking in your application, then you can ace any question. Okay, so Mr. Farmer, you're a 54-year-old farmer with history of, let's say, alcohol, smoking, or drug abuse, as is down with acute renal failure. So we are talking about diuretics now. Okay, what are diuretics? Diuretics are chemical agents that are administered to patients that have fluid retention, edema, hypertension, renal failure, ascites, and the like. So what does it do? If you really do not know the scientific mechanism of action of a drug, but you know that, oh, diuretic, there was a time I was in the ward, and I remember the matron asked me to serve furosemide to the patient on bed, so. And when I did that, after some minutes, the patient was able to void urine, and the patient was going to the toilet back to back, and this and that. And when I asked, the matron said the drug is used to remove excess fluid. That's all you need. That's all you need. Even if you don't know the scientific mechanism of action, but you know what the drug does, you just need to apply critical thinking. So diuretic are chemical agents that are administered into the body to remove excess fluid. Now diuretics, okay, let me just branch. Diuretics are classified into, it has many classes, I think about 5 to 6. You have the loop diuretic, the potassium sparing diuretic, you have the carbonic amylase inhibitor diuretic, you have the osmotic diuretic, you have the mercurial diuretic, and you have the thiazide diuretic. Okay, that's six classes. So once you know that this drug is given to patients who have fluid retention, and the work is to what? Remove excess fluid from the body. You know the side effect. And how do you know the side effect? If you administer something that takes excess fluid from the body, what will happen to that body that you have removed excess fluid? Dehydration will set in. This is why I talked about critical thinking the other time. You have to think. Because when you pick the first side effect, you have to think, what will be the complication of the first side effect that I have picked? That's how, even if you have not read it. Okay, if I keep fetching water and I keep fetching water and you know that the body has a limit for the amount of water that can be in the body. You know in your homeostasis, you know the body balance and everything. So you know that the body is a reservoir for water. It is not like a well that you keep drawing water, and it will not dry. So you know that if you keep getting dehydrated and you are not adding water and you are not rehydrating the body, what will happen? Severe dehydration sets. So if you administer a content and a chemical agent that works by removing excess fluid, and when I'm talking about excess fluid, you can see patients going to the toilet, asking for the bedpan, asking for the urinal pan like 3 to 4 times. They can actually void as much as 2 to 3 liters of fluid in their body. Yes. It goes like, if you administer furosemide of 50 milligram, it can work by removing up to about 2 to 3 liters. So you know that if you administer a chemical agent that works by removing fluid from the body, that comes in urine, sweat, or whatever, what will happen to that body? Dehydration will follow. And knowing fully well that there is a deceased condition, premorbid, that makes you want to administer that thing. So when you are administering it, you are not really rehydrating. So once you administer that one, what will happen? Dehydration sets in. Because for a patient with acute kidney failure, or for most patients, the rate of output is not usually equivalent to the rate of input. So once you remove excess fluid from the body, what will happen? Dehydration sets in. And once dehydration sets in, this is where you keep applying critical thinking. Okay, once there is dehydration in the body, what will follow? Okay, I'm dehydrated. How will I know that I'm dehydrated? I will begin to feel thirsty. That's number 2 side effect. Thirst will follow. And once I begin to feel thirsty, how will you know an individual that is thirsty? My lips will begin to what? Feel dry and scaly. And once my lips begin to feel dry and scaly, I am dehydrated, I am feeling thirsty, and probably you are rehydrating the patient with isotonic or osmotic fluid, but the rate of input is not in par with the rate of output. What will happen? The patient will begin to what? To feel weak. The patient begin to feel weak, muscle weakness, tiredness, fatigue as a result of what? Thirst. You know that water has a major role in the body. It has a very major and vital role in the body. And if you wake up a day and you have not actually drank water till evening, you know how you feel. So it actually constitutes a vital role in the body. So how will you know that I'm thirsty? My lips begin to get dry. You see, patients at the onset of their renal failure, when you see them, you see that their lips are scaly and they are dry because of dehydration. So the first side effect that will happen is dehydration. And once you are dehydrated, what do you begin to feel? So how will you know the next side effect? Is by the complication of the first side. Okay, I'm dehydrated. What will follow? Thirst will follow. Okay, once I feel thirsty and the rate of input is not equal to the rate of output, or I'm not getting. I'm sorry. Let me get hydrated. Thank you. Or I'm not getting adequate fluid or water. What will happen? I begin to feel weak, tiredness, muscle weakness, and fatigue begin to set in. Headache will set in. These things are compensatory mechanisms. So when these things set in, the body will try to counter it, will try to compensate for it. Headache will set in. And there is ataxia. Ataxia will also set in. And ataxia is actually loss of bodily movement. You begin to lose consciousness little by little because you have lost so much fluid. So I think, and I believe that we have mentioned about 6 to say, okay, we mentioned dehydration first, we mentioned thirst, we mentioned weakness, muscle weakness, which are not the same. We mentioned fatigue, tiredness, which are not the same. We mentioned headache, and we mentioned ataxia. That's about 7 to 8 thereabout. So that is how to ease it. That is how you go about it. Think about the first one. You do not necessarily need to know about the scientific mechanism of action of a drug. And when I mean the scientific mechanism of action, I mean how it works scientifically and mechanically. But you need to know the layman understanding of how that drug works. Once you know the layman understanding of how the drug works, you can actually know the side effect. Just like we talked about diuretics. Okay, you know it removes excess fluid from the body, and once you administer it, what will happen? The patient starts what? Releasing excess fluid as a waste product. Dehydration follow, thirst follow, fatigue follow. That is how you use it. That is actually how to go about it. But you need critical thinking. There is no amount of pharmacological tips and tricks and hacks that we can give you as a nursing student or as a nurse, wherever you find yourself. Actually have to think deep, and you have to think critically. And if you do that, I assure you that is how you use it. It works for every other drug. I tell you, it works for every other drug. Talk of any other drug, it works for it. If you know a side effect, you will definitely know the other side effect. Just pick the complication of the first side effect, and you are good. Okay, let's checkmate. What other type of drug should we talk about? Okay, let's talk about narcotics. Let's talk about opioid analgesic. Opioid analgesic is a classification of a type of analgesic, but they are opioid. They are narcotic. That means um, they are controlled drug, and an individual is at risk of what? Addiction, physical dependence, and psychological dependence. Okay, how do they work? How do they work? If I'm a student and I do not know the scientific mechanism of action of how analgesic work, but I remember that there was a time I was in the labor ward, or there was a time I was in the orthopedics or surgical ward, and pentazocine 30 milligram equivalent to 1 ml was actually administered to a patient. And when it was administered, few minutes the patient started complaining of dizziness, loss of bodily movement and bodily function. And I asked the matron there, that is why the ask that we are giving is not actually enough, but you also have to think deep, and you also have to flashbacks of your memories in books and in the world. Okay, and I remember, this happened, and I asked and I consulted my book, and I saw that it is an analgesic that is actually different from the other non-narcotic analgesic and the non-steroidal anti-inflammatory drugs that are still analgesic. It's different from paracetamol, different from diclofenac, ibuprofen, aspirin, and the like. So what makes this drug different? Okay, I don't know any side effect of pentazocine, but I know it is a very strong drug, and I know that a patient that this drug is administered to is at risk of abusing this drug. Let me tell you something now. Any drug, any analgesic that falls under the category where the patient is at risk of abusing, all drug has its own risk of abuse. Yes, put that down as a side one. All drug has its own risk of abuse. In fact, as simple as it is, you can abuse paracetamol, you can abuse amoxicillin, you can abuse vitamin C, which is ascorbic acid, you can abuse vitamin B complex. But every analgesic that falls under the category of category of narcotic, and the patient is at risk of psychological dependence. When you know that an analgesic, a drug that cures pain, falls under the category that the patient is at risk of psychological dependence, you know that it is a controlled drug. That's number one. And you know that it is a drug that brings about dizziness. You don't have to sweat. Just any drug that cures pain, that's an analgesic, and falls under a category that makes the patient psychologically dependent on that drug, will bring about dizziness. So, because pentazocine comes in oral form, but I've seen it once in Nigeria, but they are not common. They are not common. Most times it comes in injectable form, that's parenteral form, and you give them IM, IV in bolus form. But most times when you want to give patient, you don't give 30 milligram like that. Most times people give 15 milligram. Most times you dilute it because it is 1 ml. You dilute it with 5 mils. Then you divide that's making 6 mil. Then you can divide it into 3 mils, making 15 milligram per 3 mils and 5 milligram per each mils. That's calculation. We'll come back to that. So once you give this drug, the patient begin to feel dizzy. Okay, dizziness is the only thing I remember. After dizziness, what do you think will happen? There's something we call fatigue. When we were small and when we merry-go-round the whole room, when we were just playing, after about some moment, you begin to lose your body movement. Like I talked about the other time, ataxia is what we call it. Then fatigue, you begin to feel dizzy, like the whole room begins to turn. Okay, once dizziness sets in, what will happen? I'm feeling dizzy. Fatigue will actually happen. And if it lingers for long, most patients, most times, they experience what we call syncope. We call it fainting attack. Yes. Pentazocine is actually as dangerous as that. Narcotic and opioid analgesic are as dangerous as that. So you can use these tricks for all classes of drugs. we have checkmated it for all classes of drug. Just remember the layman mode of action of that drug, how it works, and when it works, what does it do? Pick a side effect, take the complication of the first side effect as the next one, and you are good to go. So thank you for staying tuned for this video. Let us know what you feel in the comment section. Please kindly share, like, and comment on this video, and don't forget to like if you have not. Kindly like our Facebook channel at Nurses Affair. We are followed by over 8,000 nurses, and it's liked by over 8,800 nurses as well. Kindly share. Thank you as you do. God bless.